Hi, this is Heidi Nelson, and welcome to this edition of Duffy Doings, our show where we talk about issues relating to healthcare and homelessness on Cape Cod and what's going on at Duffy Health Center. Today, we're going to talk about Recovery Month. Every September, SAMHSA, which is the Federal Substance Abuse and Mental Health Services Administration, sponsors Recovery Month to increase awareness and understanding of mental health and substance use disorders and to celebrate people who are in recovery. This year, the theme for September of 2017 is Join the Voices for Recovery, Strengthen Families and Communities. One of the points that we want to get across today is that substance abuse treatment and mental health services work, and that they can enable people with mental illness and substance use disorders to live a healthy and rewarding life. Recovery Month started in 1989 as Treatment Works, and it was intended to celebrate people who work in treatment services or substance abuse professionals in the field. It evolved about 10 years later to become the National Alcohol and Drug Addiction Recovery Month, and then 10 years later, it expanded to include all aspects of behavioral health. Joining me today to help us celebrate Recovery Month are two of our Duffy employees who work in our substance use disorder treatment program. So I'd like to welcome today John Barboza, who is our medication-assisted treatment clinical coordinator and a certified addiction nurse. Welcome, John.
Thank you.
And Derek Lamphier. Derek is a recovery support navigator who also works with our medication-assisted treatment program. Welcome, Derek.
Thank you.
Glad to have you here today. So, John, let's start with you. How long have you worked at Duffy, and how long have you worked in the substance use disorder treatment field?
I came to Duffy about 6 years ago, almost 6 years ago, from working at Gosnell Treatment Center as a addictions nurse. I started working in the field at about 2003. I went to nursing school and graduated in '98, and then 5 years later started working at Gosnell Treatment Center as an addictions nurse.
Great, great. And Derek, how about you? How long have you been working in the treatment field?
So I've been working in treatment a little over 2 years now. I've been working at Duffy for a little over 5 months coming up. What drew me to this work was that I'm an addict in recovery myself, and I want to give back to those who suffer from the same disease as I do. People did that for me, and I felt like the best way for me to give back was to get involved in this type of work. And ultimately, it's the most rewarding work I've ever done in my life, and I really feel passionate about it.
Very good. And John, what drew you to this field? And nursing, too. I'd be interested to know why you became a nurse.
Somewhere around 1991, about 26 years ago, I began speaking about recovery at Gosnold and other addiction treatment facilities. And that was prior to me going to nursing school. And after speaking at these institutions, I really became interested in helping alcoholics and addicts begin their recovery path. So after graduating nursing school from Cape Cod Community College, I decided then, as I did a clinical at Gosnold as a nurse, to dedicate my entire nursing career to addiction treatment, and which is what I've done. I've gone on to complete the UMass Addiction Certification Treatment Program. I've gone on to get my addictions certification as an RN. And in my baccalaureate degree at UMass Dartmouth, I concentrated all of my papers, all of my studies on addiction treatment, stigma, and marginalized populations to really strengthen my abilities to help our population.
Right.
So.
And certainly working with people who are homeless and at risk of homelessness. We're really talking about people who are in pretty desperate situations.
Desperate situations.
Yeah.
Right.
Yeah. So SAMHSA defines recovery as a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Does that sum it up for you guys? Do you resonate with that definition?
Absolutely, I can totally identify with that definition. For me, it's pretty much the same exact thing. I would say an active change in my life and my ideas, attitudes, behaviors, and to try to be the best me I can be on a daily basis to reach my full potential.
Very good. How about you, John?
Their definition, the process of change, is, to me, the equivalent of having a spiritual experience. I mean, and all a spiritual experience really is just having a change of your thought process. Our patients, once they engage with us and they experience that short period of change without drug or alcohol use, they experience some health and wellness. The idea is that they experience that little bit of wellness, that positive feeling, and they continue that change so they can become participants in our community, participants in their families, participants in their own lives, working towards their full potential. I mean, that's what, at Duffy some time ago, someone spoke and said that we were agents of change. And I've committed to that. I mean, I've taken that to heart, that we are the agents of change. We can't really change people, but we can certainly help them.
Right.
And that's what recovery is all about, is change. Changing to healthy behaviors.
And, I'm sure people out there are thinking that, change is probably the hardest thing we have to do in life as human beings, particularly as adults. And so how do you do that in your work every day? How do you help people change?
Well, I guess it can happen in many different ways, but mostly for me is to be someone of peer support, someone who can understand and identify what they're going through firsthand, and really just encourage them and in a sense kind of keep them accountable for their actions and guide them through their process of recovery.
Okay, so you say you're going to change, and then there's a commitment to it.
Right.
And
Let's reinforce that decision to get them to move forward.
Yeah. What would you add to that, John?
It's just motivational interviewing 101. What do you want to see happen to you?
Right.
What are you doing about what you want to see happen to you? And how's it working for you? And where can I fit in, or Duffy, or the recovery community fit in to help you along that pathway, moving towards your goals of where you want to be?
Right. And when I describe motivational interviewing to people, I say when our staff are working with a client, they're asking that client what they want in their lives. It's not what the therapist wants for the client, it's what the client wants for the client. And interestingly, they are probably both the same thing. If your goal as a client is to reunite with your family, our goal for this individual is for them to stop drinking and using drugs. It's probably the same goal, getting at the same place. And then motivational interviewing, all the techniques of making a plan, right? How are we going to change? And then that accountability piece, that you talked about, kind of checking in on the plan. What happens when we encounter a barrier? What are we going to do, right? I'm sure you have that conversation all the time. What are you going to do when you're out with your friends and somebody says, let's go have a beer, or whatever? And then how are you going to, and if you relapse or fall off the wagon, what's the plan, right? I mean, that's all part of the process, right?
Exactly.
Right, absolutely.
Having the patients realize that they have potential to recover. When they have a minor setback, we talk about the minor setback, how to avoid that minor setback in the future, make a safety plan, and move forward, not get stuck there. Right. It's giving those small positive affirmations to our patients that have not had anybody do that for them for a long time. All they get is a lot of negative, and we're there to show them that they are positive. Even if they have a minor setback. It's a disease process, and we try to explain them that it's a disease process. Diseases have beginnings, middles, and ends, and we're there to help them at the beginning, middle, and end. So that's my best answer.
So you both work at Duffy Health Center full time. What's a typical day like for you, Derek? As a recovery, tell the group what a recovery support navigator does, first of all. You do a good job at explaining that.
So I'm a recovery support navigator. I would say, a typical day can vary, definitely. But like I said before, I'm mostly like a peer. I'm like a peer to the clients or patients that we have, and just support them throughout their process of recovery, right? Try to show up for them when they need that help and support, and show them that they can do this, and allow them to believe in themselves that they can do this, and they can change their lives, that positive reinforcement. Yeah. Check in with them, text them on a day to day, let them know that someone's there, someone cares, right? Because like a lot of our clients don't have that, and then I can be that person for them, and allow them to like find themselves in this process and continue with their recovery.
So you're sort of a support system, right?
Right.
A lot of our clients don't have
And
family
staff.
and staff, right.
Staff needs support
Right, absolutely.
because they're not expert as we are in the addiction
right.
recovery
Right,
field.
right.
So the staff needs a lot of support.
And
Right.
it can be very discouraging
Yes.
when you're working with somebody who
Right.
doesn't see the need to make change in their
Right,
lives, right?
It's tough, yeah.
Right.
Yeah.
John, you work in our medication-assisted treatment program. Just briefly tell our audience what that means, and then what your typical
So my
day
title
like.
is the clinical coordinator. Mainly, I'm a RN case manager. I have a client caseload. I see patients on a schedule every 30 minutes throughout the course of the day, anywhere from 15 to 20 patients a day. I mainly review their lab work, answer any medical problems they have, answer any recovery problems they have, encourage them to keep all their appointments. I mean, behavioral health counseling it's an integral part of recovery, and we have that right at Duffy Health Center, and it's required for our patients to go. So I make them attuned to keeping those appointments, how important they are. I fill a lot of prescriptions. I communicate with the NPs, the MDs about patients that have addiction difficulties, either alcoholism or drug addiction difficulties. Tonight is Tuesday, the third Tuesday of the month. I have a men's group with Louisa.
Okay. One of our therapists.
One of our therapists tonight. For all our guys that have, not all our guys, but a lot of the men that started at Duffy Health Center in their recovery and had no jobs and didn't have much, have progressed now that they are working. They can't attend those daytime meetings, those daytime groups, those daytime appointments. So we arrange a 6 p.m. appointments for them and a group for them. That's what we will do the first and third Tuesday every month. We have a group of about 15 guys that meet, 2 different groups, and it's really beneficial.
Right, and our program is a high quality program for a number of reasons. Our staff,
Right.
but also the fact that we require that people participate in therapy.
Yeah.
So having the groups makes it convenient for people to meet that requirement.
Yeah.
And you also do a lot of monitoring. Sometimes people there's stigma around the use of Suboxone
Correct.
and methadone. We don't prescribe methadone, but there's stigma around those kinds of treatment because people think that you should be completely substance-free.
Correct.
But we're very careful in our prescribing habits, and we actually do very sophisticated urine drug screening with our clients. So those are a couple of hallmarks, I think, of our program.
Most patients are seen weekly or bi-weekly. We have quite a few monthlies, but we keep a really, the disease of addiction is so cunning, baffling, and insidious that having a short leash or a short appointment span is beneficial for the patient, not for the staff. It's for the patient, to keep them close, to keep them reeled in. I can't add much to that.
Yeah. So one of the things that we have started to research and work with is the use of technology, right, in recovery. And you are what we call our champion for a tool that we call My Strength. Well, we don't call it, it's what the company calls it, but it's a software that we use, and our clients can download it and put it on their smartphones, and our staff as well can use My Strength. You want to talk about what My Strength is?
Sure. Yeah, My Strength is like a self-help app that one can download on their phone or use on their computer at their home. And ultimately what it does is allow the client or staff member to really just focus on their own self-wellness. You can have activities or assignments that you can do throughout the day like say at 4:30 in the morning and you can't call your therapist, well, you can do an activity or an assignment on My Strength and really like vent and really get that out and ultimately do it through yourself, you know, so you can be a part of your own process in your healing and in your process of recovery, mental health, or just maybe physical activity. So yeah, so it's pretty much an all-inclusive, all access at any time of the day app that you can use to use for yourself, to be involved in your own individual process.
And there are videos.
Yeah,
and
videos, inspirational quotes,
things like that.
pictures, multiple. There's so much stuff. They just keep adding. And like I said, from mental health to substance use to like I said, physical activity or even diet. I mean, there's multiple things you can. Whatever you choose
Stress.
that you'd like to stress.
That's what I said in my
stress,
profile.
anxiety, sleep, whatever you're trying to
Right.
work on in your time at this point in your life, you can work on that through My Strength.
Right. Very good. Well, it's a great tool, and we'll see how it works.
Absolutely.
With our clients. So, what would you guys say are some of the biggest challenges that our clients face? I think all people in recovery have challenges, particularly Duffy Health Center clients that have so many barriers and issues. What do you see as kind of the major challenges, John? You want to start?
For the patients that I have that are dependent on alcohol and opiates, those are my main patients. I think the biggest barrier, and we discussed it a little bit ago, is change. When we are dependent and use drugs and alcohol for 10 or 15 years, we have learned behaviors that are so difficult to change. It takes great effort. Recovery means a lot of hard work from the inside and the outside. I think that's the biggest barrier. I mean, then there's a lot of little barriers. Transportation on the Cape is a barrier. When they have other social problems with the courts, managing their court dates, with their doctor appointment dates, with their behavioral health. So they have a very busy schedule, and then trying to have some upward mobility with trying to get a job. So it's just a lot of stuff when you've not been connected in the community and in your own life. Those are the biggest barriers, is that change, that shift from doing not much to having a whole lot to do.
Interesting.
Yeah.
That's an interesting observation. Yeah. Need a calendar.
And we give out free calendars.
Right.
Sure. What do you think are the biggest challenges, Derek?
I'd have to agree with John. Ultimately, like my own personal experience, and then I know for a lot of our clients, you come in living your life a certain way for a long time. Change is hard for everybody, especially when you're used to doing something a certain way, and then now someone's telling you to do it the complete opposite. It's scary. You're full of anxiety. You're full of fear. What do I do? You know what I mean? So I feel like the change process ultimately is the hardest thing for individuals to do, is change their way of life, right? And then, of course, some of us come in and they try to do this, and then they fail, and they come back. So they feel like they maybe not be able to do it, and that's nice where like I can come along and say, hey, you can do this, that I believe in you, that this is possible for you. Everyone, anybody can recover. Transportation, of course, legal issues, housing. I mean, it could really vary. It varies from patient to patient. But I would say that initiation to change and stay committed to it, right? So you can start that change, but if you don't stay committed and continue, because it's hard. It takes a lot of work, I think, ultimately, to stay in the process of recovery. It takes work, and a lot of us in the beginning don't want to. But I think initially, a lot of people who come through the doors, they're there because they want to change their life, right? How can we help?
It's a big step to walk in.
How can we help them and guide them through that process? Is ultimately, and that's what we do. We're great at it. The clients and the patients know, they trust the Duffy name. They know they can come to us for help, and that's why they continue to do so.
Well, and one of the beautiful things about having our addiction treatment programs embedded in a primary health care clinic is that people don't have to know when you walk in the door what you're coming in for.
Yep.
You could have diabetes, you could have a head cold. There's no reason for anybody to know your business, really,
Right.
about why you're there. But we do hear that the word gets out. Our number one way of people hearing about Duffy Health Center is not through the newspaper or through a TV commercial. It's really word of mouth, and people talking to each other about that, right? It's interesting that you talk about, one of the things I say about homelessness often is that, it can be a very political thing, that people on the left say it's all about housing and jobs, and that people don't have the tools that they need, and people on the right want to make it all about a person and their personal vulnerabilities or weaknesses, or their lack of interest in changing their lives. And I think what we know is that it's really both of those things, right? So if you take somebody who has an addiction issue or a mental health issue, and then you throw into the mix that it's hard to find an apartment that you can afford, and if you had a job that paid a living wage, then you'd be able to afford the housing, and it's so much easier in your life to make change and free yourself, right, from the addictions and get yourself on a path if you have kind of all the right tools.
Right. Absolutely.
Yeah. We all have, I think, many people have friends and family members, right, with addiction issues or mental health issues. The difference is they have us, right? They have a support system, and we're there to help support them, and a lot of people don't.
Don't have that.
Don't have that support system. John, you've worked in treatment a long time. What's different now than when you started working in the addiction field 15, 20 years ago?
15 years ago, as an addictions nurse, an inpatient detox, 90% of the patients were alcoholic, 10% were opiate dependent. It's a shift now. 90% are opiate dependent, and 10% are alcoholic. That's the biggest change I've seen. The treatment course hasn't changed much. I mean, the treatment is pretty abstinence from drugs, peer support, professional support, and you get well. Having that external control for our patient population is a tough one for them. We need to remind them that it's temporary.
Right.
Get that external control, which is me, get them going, and then I go away, and they carry on with their lives, and they become well. So.
Well, and I think that we specialize in working with medications to help people to make that transition. But we all really believe that the end result has to be sobriety. That you have to. There are many pathways to get there, but if you really believe in the biological basis of addiction, the only way you're going to be free of it is to be completely free of it. And I just hope that people out there understand that, as well.
The change I just didn't even think about was the medications that came in around 2006. Vivitrol, and then Suboxone followed a couple of years later. Really, Suboxone really helped keep patients in treatment, especially the opiate dependents. Before Suboxone, opiate dependent patients did not last long. They did not complete treatment less than half the time. With Suboxone, they complete treatment 95% of the time, inpatient, and then they follow their treatment outpatient. But the medication that we use now really helps maintain them in that short period of time to get some exposure to some recovery and some recovery education inpatient. And I think our success has been better. Our retention rate at Duffy is about 75% of our patients remain with us a year or more, which is fantastic.
Good results.
Stigma about using medications, we're still working on. It's going to be a long haul. I don't think the public understands the difference between drug use and prescribed medications when it comes to heroin or Suboxone. They can't seem to separate the two. It's not a crutch, it's a life-saving medication that I want I would love for everyone to understand that.
Right.
But we're working on it.
Right.
Right. So, discouraging that we still have the stigma, but hope that things are changing. There was just an article in the Globe yesterday about MAT in prisons, and that now prisons in Rhode Island are routinely using Suboxone.
And methadone or just about
And methadone,
Yeah.
yes. If somebody comes in and they're using methadone and Suboxone, they can continue.
Yeah.
And people who are getting ready to be discharged, if you're within 3 to 6 months of being discharged, they'll start you on Suboxone, which is really very progressive.
It's forward, yes.
They are
Yeah.
in Rhode Island. So, Derek, you're a young person. What's it like? We all the old people want to know what it's like to be a young person on the Cape, and what keeps you here. What do you love about living and working on Cape Cod?
Well, almost 30. I'm not that young. But
That's right. That's over the hill.
right,
once you hit
yeah,
30.
I'm almost there. What keeps me on Cape is, my own recovery process brought me to Cape Cod. I'm originally from Lowell, Mass, and
Okay.
what keeps me here is it's beautiful, you know what I mean, and that the recovery on Cape is unbelievable, unlike I've ever seen anywhere else. For me,
Right.
it's a beautiful place to live. I have an incredible network, and I just love to live here. It's completely different than a city life. A little more quiet, more laid back, and for me, that's something I never had, you know, growing up. And for me, it feels like more like home here than I've ever felt back home.
Very good. Very good. Well, we should also say for the audience that John and Derek are just two members of a team. We have Jennifer and Alicia, who are our other MAT nurses, and Dominique, who's our other recovery support navigator. We have Dr. Lisa. We have our administrators and managers and people that support everything that you do. So this is in honor of them as well. National Recovery Month, September. So thanks once again, Derek and John, for being here with us today, and thanks for watching.
Thanks for having us.
Thank you.